Hi, my name is Carli Reimer. I'm a third-year nursing student, and today I'm going to be reconstituting and further diluting a medication and giving it via mini bag. So the first thing I'm going to do is I'm going to look at the MAR and the patient's information. So we have Emma Wrightson, and she got scratched by her cat, and it's getting infected. So we're just going to be giving her some Penicillin G for the infection. She has no known allergies and no other contradictions to taking the medication. So now I'm going to wash my hands. I'm going to gather my supplies. So I'm going to get my medication and my sterile water and my syringe and my blunt fill. So I have all of my supplies here, and now I'm going to do my first check. So I have Emma Wrightson and no known allergies, so the right medication is Penicillin G. We need 3 million units and the vial has 5 million units, so we have the right amount. The route is IV, and it says it's an IV medication on the vial here, and the right time is now, and she hasn't gotten the medication yet, so we're good to give it. So now I'm going to take a look at the parenteral drug monograph. So it says Penicillin G Sodium. The classification is antibiotic, so this is to help with her infection. It can be given by a nurse or a student nurse, and I'm a student nurse, so I can give this medication. The usual dose is 2 to 4 million units, and we're giving 3 million units, and the maximum single dose is 5 million units, and we're giving 3, so that means that it's within the normal range. So we have a 5 million unit vial, and we're going to be adding 8.2 milliliters of sterile water for a total volume of 10 milliliters and a final concentration of 500,000 units per milliliter. So it can be given IV intermittent. We will dilute it in 100 milliliters of normal saline. It can be within 50 to 100 milliliters, but we're going to be giving 100 milliliters because the patient is a little bit dehydrated, so we just want to make sure that her fluid balance is maintained. We're going to be giving it in normal saline. It can be given in normal saline or dextrose, but she has no need for dextrose. So we're just going to be giving it in normal saline, and it can be administered over 15 to 30 minutes, and we're going to be giving it in 30 minutes just because we don't want her to have any side effects to the medication, so we want to catch it early if she does. So if we give it over a longer period of time, then we'll be able to catch the side effects when they're not as intense. So it's compatible with normal saline, and we know that we have a normal saline bag running right now as the primary infusion, so it's compatible with that. And some side effects can be a rash, electrolyte imbalance, anaphylaxis, or other side effects such as that. It can also cause GI disturbances such as diarrhea or nausea. So we'll just keep that in mind as we're giving the medication. So I'm just going to put my drug monograph to the side, and now I'm going to start preparing my medication. So I'm going to get my vial. I'm going to open it up. I already had washed my hands previously before handling the medication, so I know that my hands are clean. So I'm going to get my alcohol swab. I'm going to open it up and swab for 30 seconds and dry for 15, but for the video I'm just going to not do for total 30 seconds. Then I'd get a new alcohol swab. I'd swab my sterile water for 30 seconds and dry for 15. So we know that we're going to be drawing up 8.2 milliliters of sterile water as the parenteral drug monograph shows, so we have 8.2 milliliters. So I have my 10 milliliter syringe. I'm going to wing back the flaps and remove it. And then I'm going to wing back the flaps of the blunt fill just to maintain sterility and attach it to the top. And I'm going to draw back to 8.2 milliliters of air just so then the pressure in the vial is maintained. And I'm going to inject the air and draw back the fluid. So I'm going to make sure all the air is injected. And I draw back the full amount of fluid. I'm going to remove this. And I'm going to use the scoop method to pick up the cap. And I'm going to tap with the bubbles just to make sure that we're instilling the right amount of sterile water. So we have 8.2, and now I'm going to instill it into the vial. So I already swabbed the top, and now I'm going to inject it. So I'm going to instill the sterile water and then let the air release, so then the pressure is equal and we don't get any spray back. I'm going to remove the needle, and I'm going to recap it using the scoop method. And now I'm going to roll the vial between my hands, making sure we don't shake it because I want to not get any air bubbles into the medication. So I'm going to roll it, and it looks like It's reconstituted, there's no chunks of medication, and it looks all even throughout. So now I'm going to get a new alcohol swab, and I'm going to swab the top of the vial for 30 seconds and dry for 15, just in case I touch the top because we don't want any bacteria getting in. And through my calculations, since we need 3 million units and I had 5 million units, I've calculated that we need 6 milliliters, because 3 million divided by 500,000 is 6 milliliters. So now I'm going to draw back 6 milliliters of air, and I'm going to inject the air into the medication vial, and I'm going to draw back 6 milliliters of fluid. So I have my 6 milliliters of medication, and I'm going to use the scoop method to recap, and I'm just going to tap out any air bubbles to make sure that we have the right dose. And I have 6 milliliters. I would just waste that over the medication waste bin. So we have 6 milliliters, as you can see here. And now I'm going to have my label here, which I already wrote up with. So then the patient's name is Emma Wrightson. Penicillin G is the medication. The dose is 3 million units. The right volume is 6 milliliters, and we're going to be diluting it in 100 milliliters of normal saline. But first I'm going to do my third check. So we have the right patient, Emma Wrightson. The right medication is Penicillin G. We have Penicillin G in here, and we have Penicillin G Sodium vial. We have 3 million units, which is 6 milliliters. We have 6 milliliters in the syringe, and this was a 5 million unit vial, so we know we have the right dose. The right route is IV. We're going to be giving this via mini bag, and this says IV use only, and the right time to give it is now, every 4 hours, and she hasn't gotten it yet, so we know that's the right time. So now I'm going to get my mini bag. So I have my mini bag here, and it's 100 milliliters of normal saline. Like I said before, we're giving it because she is a little bit dehydrated, so that's why we're giving it via mini bag. So I'm just going to swab the port for 30 seconds, dry for 15, and make sure it stays sterile. And now I'm going to remove the cap and inject the medication into the mini bag. Remove the needle and throw this away into the sharps container. Now I'm just going to mix the mini bag around to make sure the medication is distributed evenly throughout. And I'm going to add the medication label to the top. So now we know that the total volume of the mini bag is 106 milliliters, and the total concentration of medication in the bag is 28,301.9 units per milliliter. Now I'm going to get my supplies ready to go to the bedside, so I'm going to have an alcohol swab, my secondary tubing, and my MAR, and I also just have a blue cap just in case we need one. And now I'm going to, and my label for my tubing. So now I'm going to go to the bedside. So I'm going to walk in, do a safety check, wash my hands, make sure the bed's in the lowest position and the call bell's within reach and the patient's not in any visible distress. Hi, my name is Carli Reimer. I'm a student nurse, and I'm going to be giving you your medication today. Can I just take a look at your IV? So I'm just going to look at the IV site to make sure it's not red or swollen, and it looks good. And now I'm going to just check the tubing to make sure that none of the clamps are done up, and make sure it's running, make sure the right right primary bag is infusing, and make sure that the primary bag is infusing at the correct rate, which it is. So now I'm going to get my MAR, and I'm going to compare it to the patient's wristband. So can you tell me your name, please? And can you tell me your date of birth? And he verbally confirmed both of those two identifiers. And do you have any allergies? No? Okay. So he has no known allergies. Now I'm going to do my third check. So we have Emma Wrightson, Penicillin G, 3 million units, 3 million units. The route is IV, and we have it in a mini bag, and the right time to give it is now. So now I'm going to educate my patient. So Emma, this medication is because of your cat scratch. So you have like a little bit of an infection on your arm where you got scratched by the cat. So this medication is just going to help to relieve that. So some side effects, maybe some GI disturbances. You may also have some irritation on this, like on your skin, and yeah. So if you have any nausea, vomiting, diarrhea, or any like GI disturbances, you can just let me know, and we'll try to fix those for you. Right now you have the right to refuse. Would you like to take this medication? Yes? Okay, sounds good. So now I'm going to get my secondary tubing. I'm going to remove it from the packaging, and I'm going to lower the primary bag. So I'm going to put the primary bag on and lower it, and I'm going to get the secondary tubing, and I'm going to attach my med label, or my label right away, just so we know, the other healthcare providers know when the tubing was used. I have the time, date, and my initials on it. So now I'm going to close the roller clamp so we don't lose any medication, and I'm going to remove the cap and sterilely remove this cap, and now I'm going to spike the mini bag, and I'm going to hang up the mini bag here, and I'm going to attach it to the port above the Baxter pump because we want it running through the Baxter pump. We want the secondary line to be regulated by it. So now I'm going to get an alcohol swab, and I'm going to swab this port for 30 seconds and dry for 15 because we want to make sure that there's no bacteria getting into the line. So I'm going to swab the port for 30 seconds, dry for 15. Good, and now I'm going to keep it sterile. And I'm going to remove this, and now I'm going to attach it. And the line is now attached. So now I'm going to back prime. So I'm going to take this bag and I'm going to open up the clamp. So I'm going to lower it below the height of the primary infusion bag. And we're doing this to get all the air bubbles out of the tubing so that it doesn't cause a pulmonary embolism to the patient. So once the drip chamber is filled about halfway, we're going to hang the bag back up, close the roller clamp, and now I'm going to program my secondary line. So I have done my calculations, and our total volume is 106 milliliters, actually it's 200. So our total volume is 106 milliliters, and we want it to run over half of an hour, so we have 212 milliliters per hour because 106 times 2 is 212. So now I'm going to confirm secondary, and I'm going to press start. So the secondary line has started, and we have the volume and the right rate. I'm going to make sure all of the clamps are undone. So make sure this clamp is undone, make sure all these clamps are undone, and they look good. I'm going to watch to make sure that there's 3 drops going, and I see 3 drops. And now I'm going to sign my MAR. So I'm going to sign date and time that I gave the medication, and now I'm going to tell the patient, okay, so I'm going to come back to check on you in about 30 minutes. That's when your medication will be done infusing, and we just want to make sure that you're doing okay. If you have any issues, just let me know. And I'm just going to be also monitoring the white blood cell count because we want to make sure that the medication is therapeutic. So in half an hour, I'm going to come check to make sure that the primary line has begun infusing again, and then I would do my exit safety check, make sure the bed's in the lowest position, the call bell's within reach, and all of the clamps on the tubing are undone, and then I would exit the room.